My name is Dr. Hess Panjeton. I am an anesthesiologist and interventional pain physician. I am the medical director at Barnes-Jewish West County Pain Management Center. As anesthesiologists, we're very used to seeing patients for a brief amount of time and having very minimal verbal interaction with them, and oftentimes while we're treating them, they're asleep. So once they wake up, they may not remember us and we're on to the next patient. So pain management is quite a 180 turn from that perspective. I think some of the things I like about interacting with patients is when they walk into the door, I want to make sure they have a great experience from the moment they walk in to the moment they walk out. These are patients who are coming in a very vulnerable state. Sometimes they're not very happy because they're in constant pain. It's my job to show that empathy, to show that understanding, and to mainly show that I'm there to listen, that I'm there to guide them during this journey of helping manage their pain better. There's a very multidisciplinary approach that is taken to each and every individual who comes through the door. So there's no cookie cutter approach when we treat a patient. Each patient is kind of viewed as a unique individual with their own set of unique needs. I reassure the patient that cases can be discussed in a large multidisciplinary format with multiple professionals from various disciplines. So that provides a level of reassurance to the patients that they are in good hands. A lot of the times when you go to an academic institution, maybe you've been to multiple places already and the results have not been optimal. We're often faced with challenging cases where we need to think outside the box and reach out for help from our colleagues. I think one of the best indicators of growth of a clinic and a reflection of how good of a job you do is word of mouth. When we hear other patients come to our clinic and say, hey, the only reason I'm here is because my brother, sister, mother, father, daughter, cousin, neighbor told me to come because they had such a good experience. So that transference of trust from one person to the next to come to our clinic and provide us the opportunity to care for them means the world. So it shows us that we're doing a good job, that we're doing right by the patients, and our focus is on them and their well-being.